Going to talk
and chairpersons. So, Dr. Arvind has explained most of this technique, and he has shown beautiful videos also. What I would be speaking the basic mechanics of this technique, what happens actually, and how we can crack the hardest of hard nucleus and even the rock hard nucleus with this chopper. So, the topic is Terminator the Wedge tool to crack and break the mature hard cataract and even the rock hard cataract also. So we don't have any financial interest in the in this chopper. It's marketed by Epsilon, and it's there. They have patented also this chopper. So you have seen these hard cataracts gives us many challenges during the surgery, and these challenges are primarily because of the density of the nucleus, the capsular changes, the absence of corticonuclear, cortico and epinuclear buffering material, and many times there is a adhesion of the capsule with the nucleus. So it gives you a problem in visibility because you are not very sure, like you don't have the glow behind, so visibility is very low. The capsular changes makes it difficult to produce the capsular axis, and if you have an absent cortico-epinuclear buffering material, then you are very close to the posterior capsule. So all your maneuver is going to directly hit the posterior capsule, and then you may land up with the complications. And if you have a adhesion of the capsule with the nucleus, then your hydro procedures become very difficult. And if you tend to inject too much of fluid, and then you can open up the posterior capsule. So these are the problems we come across in these hard cataract. And the most important problem is they don't break easily. So that is the biggest problem, because we all face in hard cataract surgery, like when you have a hard cataract, then the problem comes how to break the nucleus. But the nucleus doesn't break with many of the techniques, the whichever technique you use. You can break these nuclei with the existing techniques, especially if you have a nucleus of grade 2, grade 3, grade 4 up to, but when you come across grade 5, grade 6, or even the hardest of hard cataract or the rock hard cataract, then you are unable to break the nucleus. So you have to do a lot of trenching, a lot of other maneuver. The reason behind is because the center of the nucleus is so tough. It's the center of the nucleus, and all our procedures are directed at the center. Whether we are doing the horizontal chop or vertical chop, trenching, divide and conquer, what we are doing basically, because we are attacking the center of the nucleus, we are trying to split the nucleus from the center, we are trying to divide the nucleus from the center, and we know that the center of the nucleus is the hardest and is the thickest. So anything, any forces you apply at the center of the nucleus, you will need too much of force, you will need too much of energy, you will need too much of phacoforces, and which could be deleterious to the corneal endothelium, it could be deleterious to the posterior capsule. So that is the reason we land up with many of the complications with the hard cataract. And the techniques what we use, because I'll show you, this is the horizontal chop we do in most of the cases. We used to do horizontal chop, but in horizontal chop what happens, like if you are grade 2, grade 3 nucleus, you can crack them very easily. But if it's a harder than that, then you don't come to split the nucleus properly, because the nucleus is so hard at the center, and you have to bring the chopper from the cut the nucleus. You are trying to cut the nucleus and then trying to divide it at the center, which doesn't happen in many a times. Then what we do, we have to opt for the more of hybrid techniques. So hybrid technique, you know all. You have to do the trenching, divide and conquer. You have to go in for the multiple strokes on the nucleus. So these strokes, you are generating too much of phaco energy and heat energy within the capsular bag, within the anterior chamber, and which could hit the endothelium, which could hit the posterior capsule also. And that is the reason, like many of times you land up with the corneal endothelial damage. So these are even the thermal injury, very common, because you must have seen thermal injuries and the corneal burns, mechanical injury to the capsule, posterior capsule. Many a times you get into the problem with the iris trauma, PCR, and so many complications you have seen. So all these complications, why it happens? Basically because you're tackling very hard cataract, very hard and thick nucleus. You're trying to divide it. You are trying to use too much of phaco forces, too much of energy to divide it. So these are the reason like you get into this kind of problem. But mind it, like one very important point, any hard object, as Dr. Arvind has shown, Griffith's theory says like hard objects, you can crack them very easily. If you are not able to cut, if you are not able to crush, you can crack them. You must have seen a block of glass. If you try to cut, it will take a lot of time. But if you want to crack it, you can crack very easily. Similarly, a hard rock, if you try to crush, if you try to hit it directly, it won't break. But if you try to crack from some point where it is the weakest, or you try to create a weak point within it, you can crack it very easily. But then you need to crack these hard object. You need a device. You need a proper device. So this is the device you can see here, because this is the device which is used. This is called the chisel, and this is used to crack these hard rocks. And this is been used from the ancient time. We all have seen the people, those who break the hard rock, as Dr. Arvind has shown that video, because he was trying to use the chisel to crack that hard rock. A very small instrument, very small device, and you just go into the weakest part of that hard rock and you crack it. The whole big rock you can crack into two pieces. So how? It's basically because of the Griffith's theory of brittle fracture, which says that the force which is created at the weakest point of that hard object, it transfers, like a vertical force transfers into a horizontal force. So that is the reason how you can crack. But the devices what we use normally now in our phaco-cataract surgery, so this is the device we use, the choppers. The existing choppers are flat profile. They have a flat profile. Flat profile means like it's thin and flat, and that is what we use, because they are basically meant to cut the nucleus. So in horizontal chop, we are trying to cut the nucleus from the equator, from the periphery towards the center. We cut the nucleus and then we tend to split the nucleus at the center. So we try to cut. So this is that is why these choppers are designed in a way, they are like sharp knife, a cutter. And what happens if you have a nucleus of this kind, you are not able to cut it properly. So cutting the nucleus is more difficult than cracking the nucleus. So what you can see in this video, like this is the current chopper we use with a different design, but the basic concept of the choppers, the current choppers, is it's a flat profile, it's a cutter. So you use to cut the nucleus. And what we have done is like we converted this chopper into a cracker. So how we converted, you can see here on the next video, we incorporated this wedge design into the tip of the current chopper. So this is the wedge design we incorporated. So you can see the wedge within the inner edge of the chopper. So now it is a cracker. It doesn't have a sharp tip. It works like a cracker. It works like the chisel. And so you can see the design here. So this is the inner edge. So inner edge is a wedge, and the tip of the chopper is round. It's a round olive tip. So why it is made round olive tip? Because in terminal chop you have to hook the nucleus. You hook the nucleus from the equator, and while hooking the nucleus you have to have a round tip. So if you have a round tip, it will never hit the posterior capsule. It will never threaten the posterior capsule. You will never have a posterior capsular damage, because it's hooking around, and then this wedge design will crack the nucleus. So you can see here in this video how it cracks. See, because you hold the nucleus, just penetrate from the center superficially towards the equator, hook it, and then draw it. So you get a crack. So you get a full cracking. The best part of this device is like when you're hooking it around, you'll get a complete full thickness cracking. So that is the most important part, because in most of the cases or most of the technique, when you attempt in this hard cataract or the rock hard cataract, you are always left with the posterior plate. And if you are left with the posterior plate, and then comes the problem, because you are not able to break, you have to go very close to the posterior capsule. And if you try to break that posterior plate of the nucleus, you may hit the posterior capsule with a sharp chopper or the phaco tip. So that is the reason like you get into the problem of PCR and many of these complications. But here in this technique, you are absolutely safe. Absolutely safe means like you are chopper's tip is round, you're hooking it around. If you hook it to the full thickness nucleus, you hook full thickness nucleus, you will definitely get a full thickness crack. That is the reason you get a full thickness crack. And this crack would help you to split the nucleus into 2 complete pieces. And if you have a 2 complete pieces, then you can go in for the 4 complete pieces, and these nucleus pieces are free, absolutely free nuclear pieces. You can very simply hold them, draw them, and emulsify. So it becomes so easy. So what is the basic phenomena in working of this device? See, actually, as I told you, because you can see here in this picture, this is the device, this is the wedge inner edge. So when wedge inner edge penetrates into the hard object here, what happens? You are putting a force horizontally. So this is called as the force redirection. So the force which is put horizontally is transferred transversally. So that is called as a fracture force. The force, the horizontal force, is converted into a transversal force. So that makes the fracture of the nucleus. So you can see here in this small video how it works. See this video, you can see the animation video. This is how it cracks. When this wedge enters into the hard object, it makes a fracture force, that is transversal fracture force, and that is why like the hard objects crack without cutting. You are not trying to cut it, you are just trying to fracture the hard nucleus. A nucleus fractures so easily with a very limited force, because the force amplification is also there. When you are applying a force from periphery into the nucleus, the amount of the force, whatever amount of the force you apply, is being amplified. So there is you put a little force, but ultimate force on the nucleus is amplified. So that is the reason you get a better fracture. And we did a lot of work on this device. We tried many angulation of the wedge angulation. We tried from the minimum to the maximum, but what we have seen in our study is the 75-degree angulation of the wedge works the best, because this gives you the maximum transversal fracture force. This gives you maximum force amplification, and less than this would not work like a cracker. More than this will also not work like a cracker. So the 75-degree angulation of the chopper works the best, and you can see how it works, because this is one of the very hard nucleus. You can see here grade 5, grade 6 nucleus. Would have been very difficult to crack it otherwise, but here with this device, you hold it, hook it around very simply, a very small pupil also, you see the crack. So this is the crack you get. So you can crack these hardest of hard nucleus so simply, even with a smaller pupil. So this pupil is not very large, it's around 4.5 to 5 millimeter, but still see, under visualization, as Dr. Moria said, like there is a myth, people think that this is a blind process. No, you can see the edge of the nucleus, you have to hook around, and you can very simply fracture, even in a small pupil. See the next video, a very hard cataract. And
Dr. Rajendra, you have to wind up. We got just 9 minutes for 2 talks.
Okay, just 1.5 minutes I'll take. So this is how you can crack. So why you get a beautiful crack is because you are working at the equator. You're not working at the center of the nucleus, you are working at the equator. If you work at the equator, there's the weakest part of the nucleus, you can hook it around and can crack. So I'll just show you this video, not this one, I'll show you a little harder cataract. You can see this is almost grade 6 or grade 7 cataract, and even this kind of cataract also you can break so simply. See, you have to just hook it under visualization and you crack it. I'll just I just want to show you this slide, very important slide, how people keep on asking like how this technique is different from the horizontal chop. So people say like this, it's kind of horizontal chop. No, it's not at all. It's not a horizontal chop. It's absolutely different. You can see here in horizontal chop, your phaco probe is like this. It's directed towards the center and deeper into the nucleus. But in terminal chop, your phaco probe is directed superficially towards the equator. That is the number one difference. Number two difference, in horizontal chop, your chopper is positioned at the periphery and then it's penetrated, and then you have to bring it towards the center, cutting the nucleus. You cut the nucleus from the periphery towards the center. But in terminal chop, your cracker is hooked around, and the phaco probe and cracker both at the equator. You crack at the equator itself. Your cracking happens at the equator itself. Unlike in the horizontal chop, you tend to try to crack the nucleus at the center. But here the crack is initiated at the equator itself, which transfers to the center and to the equator on the other side, and you get a complete two pieces of cracking. So just to conclude, if you are holding the nucleus at the equator, hooking it around, and then cracking at the equator, and splitting the nucleus into two complete pieces, this is the basic principle of this device and the cracking of the nucleus with the Terminator. Thank you very much.